One thing I've actually gotten consulted for multiple times is how to manage hiccups. Yeah, of all things, a nurse is calling on behalf of a physician to the pharmacy to ask the pharmacist, hey, how can we control a patient's hiccups? This is kind of silly. I'm on Up to Date right now, and imagine if I was on the other line with the nurse, expecting them to give like this answer to a physician, being like, "Oh, have you had the patient bite into a lemon? Oh, okay. Have you had the patient gently but firmly press on their eyeballs? Oh, okay. Have you had them swallow a teaspoon of dry sugar?" And expect them to take that seriously. So, all jokes aside, we actually do have medications to manage hiccups. So this is chlorpromazine, which is the generic name for thorazine, and this is actually the only medication that's FDA approved for treating severe hiccups. Yet this medication is not the first line medication that we typically go for when treating hiccups, and that's because this medication is a first generation antipsychotic. So the way that this medication works is that it blocks dopamine receptors in a lot of places, but specifically in the medulla and the pons in our brainstem. And the brainstem is responsible for a lot of involuntary functions in our body, whether that be our heart rate, our blood pressure, breathing, and in this specific situation, involuntary movements like inappropriate hiccups. But this medication is, for lack of better words, a dirty drug. And what that essentially means is that we can certainly get our primary goal of reducing the hiccups that are causing this patient distress at the cost of other effects. So like I mentioned in the brainstem, involuntary movements, but we end up lowering blood pressure, we get CNS and respiratory depression. So when giving this medication, specifically IV, you might start with like 25 milligrams, we have to lay this patient flat and give them an IV infusion and hope that we're not tanking their blood pressure. So instead, we might reach for another medication to use first, that we might use for off-label treatment of mild to moderate hiccups, and that medication could be baclofen. And baclofen is a muscle relaxant, and the way that it works is that it's a GABA agonist. So GABA is an inhibitory neurotransmitter that helps to suppress the actions of other neurotransmitters. So let's say that neurotransmitter could be acetylcholine, binding to a muscle like the diaphragm that helps the lungs inhale and exhale. So in fact, this muscle could be spasming, causing something like hiccups. So we could use a medication like baclofen to further enhance the activity that GABA would have on the diaphragm to hopefully help reduce those hiccups. The caveat is there's a multitude of different reasons for hiccups. So post-operatively, if you were intubated, you could certainly get hiccups that way. Gastroesophageal reasons, like if you have GERD. Medications can even cause hiccups, like specifically dexamethasone is a recognized cause of hiccups. But more importantly, there could be something like physically, anatomically wrong that is causing you hiccups. Like there could be some very serious medical issue involved. Point being is that there is a thorough clinical evaluation that goes into recognizing the cause of hiccups. So recommendations for hiccups can be quite complicated, and what might seem like a straightforward recommendation could actually be a clinical intervention. So yeah, that's it.